Good afternoon, everyone. Thanks for joining us. It has been just about 1 year since we began, obviously, responding to this pandemic, but also holding these town hall forums. So I welcome you back. It's been a long 12 months, certainly for everyone. A great amount of loss, a great amount of upheaval, and real challenges for everyone. And here we are continuing to navigate our way through this. We are grateful that you're taking some time out. I know that there are going to be a lot of questions. We're going to do the same thing as we did last week. We'll attempt to get to everyone's question, but we're going to try to get the tone of the questions and get you the answers. So there might be several questions that sound very much the same. They'll hand them to me, and we'll try to get you an answer to that. We're joined this afternoon by Dr. Sunil Karana. Some of you may know Dr. Karana. Certainly I do. He's been in practice here in Dutchess County for 37 years. He is the Chief Executive Officer at Premier Medical Group. Dr. Karana and Premier have been just real terrific partners these last 12 months. We've worked with them. Certainly our Public Health Department has worked with them on our Community Health Improvement Plan and the work that we do for public and population health. But these last 12 months, Premier has been on all of our organizing calls with the healthcare community. So organizations like Caremount, Premier, Nuvance, the Westchester Medical Center group, all engaged weekly in both monitoring cases, hospitalizations, sadly having to dissect, in the general term, the death data and those individuals who have lost their life to the virus, but also now could be a much more critical player in vaccine distribution. And so while Dr. Karana is on the phone to talk a little bit more about the science behind the vaccine, and we'll take questions regarding that, Dr. Karana, I know that a lot of your patients have asked when they might be able to get a vaccine from Premier. Are you currently getting any doses? I do know some of these answers. So are you currently getting any doses? And for those who are watching today, how many doses or how many patients do you think you can provide vaccine to in a given day or week? Dr. Karana?
Yeah. Well, we can provide up to 500 patients a day. Once we get the vaccine, which we haven't gotten any, and I don't know if any other medical group in New York State has gotten any vaccines. But whenever we get the vaccine, we will plan in a way on a weekend. We can have like a mass vaccination program. We have the sites in place. We have the personnel in place. We have all the processes in place. So we'll be able to vaccinate. But again, if we get the vaccine, we will vaccinate our own patients first, like any other practice will do. And depending on what the needs are, how much vaccines we are given, we'll try to help as many people as we can.
Terrific. And you, you're correct. No major healthcare groups have had broad access to doses. There are some small organizations that have had a handful here and there, but the state has not released doses to healthcare providers en masse. So right now, the doses that are distributed from the federal government to the state of New York are principally then delivered to hospitals, to county, local health departments, to pharmacies, and to some federally qualified healthcare organizations, and that has been tightly organized and managed and controlled by the state. And last week, I certainly expressed on our behalf, but perhaps on behalf of the nearly 300,000 residents who call Dutchess County home, our shared frustration that the state has really made this process a bit more cumbersome and challenging than it needs to be. But before we get into much detail on vaccine distribution, and I do want to update you, Dutchess County is changing the way and we think enhancing the way that we'll get folks access to vaccines. I'll talk about that in a moment. But before we do, let's jump right to the county dashboard and some of the updated information. I think first and foremost, all of the data points are trending and pointing in a better direction. Excluding deaths, and as we said, January was the most fatal, if you will, of all of these past 12 months, with more deaths, over 100 deaths in Dutchess County. But we saw that, of course, in other parts of the state and country, a massive amount of loss in the month of January. All other data points are pointing in the right direction. All other data is trending in the right direction, and that's very positive. Currently, Dutchess County is monitoring 810 active cases. I actually don't recall the last time we were under 1,000. We're now at 810 active cases, 113 of our neighbors hospitalized. That is down considerably, in fact, almost half in the last 2 weeks. We sadly, as I said, have experienced 382 deaths associated with the virus, and our positivity rate has just really trended dramatically downward. Just about a month ago, we were nearly at 10%. We're now at 4.77%, 4.8%, if you will, rounding up, is our 7-day average positivity rate. And if you look at how that compares to other counties in the region, that positivity rate, Dutchess, our 7-day average 4.7. They rounded down. They must be optimistic around here. 4.77 rounds up to 4.8, but I'll take 4.7. Orange at 6.3, Putnam 4.6, Rockland 5.9, Sullivan 5.1, Ulster at 3.3, and Westchester at 5.5. And that is, as I said, all moving in the right direction. It's just as a reference, today as it compared to 2 weeks ago and the peak during the spring, we are monitoring 810 cases. 2 weeks ago, 2,422 active cases, and during the spring of last year, our peak was 1,860. Hospitalizations, again, 113, still above our peak during the spring, but much lower than the hospitalizations 2 weeks ago. And let's be realistic, some of that has been a slowdown in the transmission of the disease, the virus, but that is also a result, sadly, of individuals who were hospitalized losing their life to the virus, and that's a real and sad fact to keep in mind. I know that we're going to want to talk a little bit about vaccines, so let's see what questions we have. Questions about comorbidity. Can we get them to go to a pharmacy? How does one prove that they have a comorbidity? We're going to get to that in a moment. And why is Dutchess allowing seniors to be vaccinated at JCPenney or Dover? Isn't the state telling seniors to go to pharmacies? Other counties aren't vaccinating seniors. Other counties are vaccinating seniors. First and foremost, every county in the state's trying to navigate the state's order that we give priority to the essential workers. But I guarantee you, because I talk to the county executives daily, we are all trying to accommodate senior citizens to a degree. What I would also say is part of our job constitutionally is to provide service to all of the people who call our communities home. So we're all trying to navigate that. And again, we're on calls every day, the county leaders in the 7 counties in the Mid-Hudson region. And I will tell you, every couple of weeks, all of the county leaders across the state meet. Every one of us is accommodating to even the slightest degree some population that isn't exactly that essential worker. And if you look at the governor's directive, they order us to give priority to essential public workers. We'll talk a little bit about that. But every county in the state is accommodating seniors. And keep in mind, some seniors are essential public workers. Some are working at a grocery store, some are emergency responders, some are volunteers, some are teachers, some work in a daycare setting. Those are all populations that are currently identified by the state as essential for the counties to focus on. But to that question, every county in the state is providing some access to senior citizens. Let's talk about what we're doing with vaccines. So, Sean, what I want to do is let's start first with the vaccination rates. So we're going to jump to the regional vaccination rates. This is important information. So. This is so the state of New York gets those vaccines from the federal government every week. The state then distributes those vaccines. Those vaccines are given, as I said, to pharmacies, hospitals, some healthcare providers, generally federally qualified healthcare clinics, and local health departments. Now we don't get the smallest amount, but we also are not getting the largest, right? So county governments are relegated to a very small role when it comes to the number of doses that we're given. And as I answered that previous question, we're also directed by the state, it's an executive order, as to who we can vaccinate, the health department, and how the individual must access their appointment. All of that strictly controlled by the state, and it's caused a great deal of conflict and a great deal of frustration, and we know it. We see it. It's everywhere. There are people in Orange County saying, I wish you did it like Dutchess. There are people in Dutchess County saying, I wish you did it like Ulster, and so on. This is the reality, because I think everybody in a particular county thinks that they have some authority over the program. They don't. The state of New York does. And so while we believe that more doses need to be distributed to healthcare providers and local health departments, the state is centralizing most of its doses in the region every week to its regional vaccine sites. So the state of New York takes about 7,000 doses and sends it to the county center in Westchester. That is the Mid-Hudson region state site. Understand that. So if there aren't appointments available there, and you're calling the state hotline, they might suggest you go to Potsdam, or they go to Binghamton, or you go to Long Island. The reason they're not sending you to a local site is because they're only giving you the direction to go to another state site where the state has directed most of its doses. But if you look at Dutchess County as a percentage of the entire state population, we represent about 1.5% of the statewide population. The percentage of doses Dutchess County has received statewide is 1.2%. A little bit less than what we represent in population. Not much. I mean, it's negligible, but still, we're receiving in this county about what we represent as far as population. Now, of Dutchess County's entire residents, 6.5% have been vaccinated, have received at least the first dose of population. The statewide average is 8.2%. Now, we would argue that has something to do with proximity to a vaccine site. And the lack of doses. So each week the state is monitoring this data, and in theory is going to alter the distribution so that we can be sure that all parts of the state are meeting that average. Of course, the point of an average is it's somewhere between the highest and the lowest. But nevertheless, if we're all in and around 8.23%, at least then you can prove equitable distribution. That's where we are as a percentage of the total doses. So if you're sitting back thinking, well, Dutchess isn't getting its fair share, I mean, the truth of the matter is that no one is. But Dutchess, as it relates to population, we're getting about what we represent in population. It's just it's not enough. If you look at Orange, 1.3% versus their nearly 2% population. Putnam's about even, 0.5% in doses, 0.5% in population. Rockland, 1.7 against 1.6 population. Sullivan, 2% against 0.2% against its 0.4% population. Ulster, 0.8% in total doses received versus 0.9% of its population. Westchester, 6% of total doses received in the region against its 4.95% total population. Again, a lot of data points, but it just shows that the distribution is relatively equitable. It's just not enough getting to the locations like Dr. Karana, like the local health departments. So, Dutchess County on any given week is given doses. There are approximately 3,000 doses administered in Dutchess County this week. That is pharmacies, that is healthcare clinics, that is hospitals, and that is the local health department. That is a little bit higher than it was 2 weeks ago. And in the county as a whole, 3,000 doses being administered. Now, you're correct to think that the state doesn't restrict only to Dutchess residents. So it's not that 3,000 doses are getting only into Dutchess County residents' arms. A hospital might give it to an employee who doesn't live in Dutchess County. That's their right. They work for them. Might be a healthcare professional at a hospital or a healthcare provider. May not live in Dutchess, but they're getting the dose here. You might have a school teacher that is supposed to get it through the county's health department or one of the state locations. They may be able to get it out of county. So there are Dutchess County teachers who've gotten it in Ulster and vice versa. And by the way, there are some Dutchess County teachers who are senior citizens. They may have scheduled at a pharmacy because they're a senior citizen. So there's that fluidity in scheduling. There's just not enough. There's just not enough availability. We recognize that since we have seen about 700 doses a week, the system in place to try to be fair is just it's creating too much havoc for you and for us. So this week, Dutchess County is changed the way in which we're going to distribute vaccines and appointments, and this is the system that we're going to use moving forward. Number one, whether or not you have already subscribed to the Dutchess County, it's called Dutchess Delivery, whether or not you are already signed up to receive an email or text to notify you that there would be appointment availability. Whether or not you were previously signed up, you must re-register. We need you to sign up again. Why would we want you to do that? 2 reasons. As you know, and a couple of the questions have been already provided us, the state has said that if you have a comorbidity, if you have some underlying illness that puts you at a higher risk, should you contract COVID-19, the county health departments are supposed to attempt to accommodate you. Now, mind you, you're talking hundreds of thousands of people across the state of New York now who are going to have to turn to a local health department. And again, if they're a senior, they might be able to get it through a pharmacy, but a local health department. We are also supposed to receive the doses that the hospitals were getting. So in theory, the hospitals are getting, let's say, 5,000 or 6,000 doses in the Mid-Hudson region. I think that's about right. It's about 6,000 doses in the Mid-Hudson region. In theory, those doses are going to be reallocated to the county health departments based on population. If I'm guessing, that would mean, and this is purely a guess, that Dutchess County would go from about 700 weekly doses, the health department, to maybe 1,200 or 1,400 in that general neighborhood. We have to be sure that we're prepared for this massive increase in the numbers of individuals that we are now going to try to squeeze through this 1,200 person pipe. Right? We have a pipe that can only handle 1,200 doses, and we have 100,000 people who need to fit through there on any given day. So instead of every week getting the link to go mad dash and click the button and be online and ready to go to get your appointment, what we're asking you to do is to update your information. It's going to include some very important questions. It'll include name, address, email, cell phone, but also age, date of birth. Then we'll be asking you to clarify for us, to qualify whether or not you have an underlying illness or some other you're an essential worker, and to classify yourself in that category. Yeah, I take a drink, they switch American Sign Language or interpreters. So we need that information updated. The other thing is, I must tell you that you are certainly welcome to sign up a loved one. But you must sign up with their information. So if you're at home and you want to take care of mom, you can fill out mom's information, but it has to be mom's information. So it could be your contact phone number because you prefer to have, if mom gets an appointment, for them to call you. But you must be sure the rest of the information is the loved one you're signing up. You can sign up anybody you wish, but it has to be their information. You got 12 family members you want to sign up, you can spend some night and sign them all up. But it has to be their information, their date of birth, whether or not they're essential worker, whether or not they have a comorbidity, has to be all of that information. Because we then take that information and we'll contact you either by text or email of your appointment. So it's a wait list. We're going to say to you that you now have an appointment available, and that appointment is to the person who signed up. How do we get there? Well, we're going to continue to focus approximately half of our doses next week, approximately half of our doses to those essential public workers as identified by the state. Now, I'm going to say something. We work with school districts, we work with police agencies, we work with the fire departments, we're working with some grocery stores identified as essential. We're working with the towns, villages, and cities. Those employers determine how they select their individuals, essential workers, to get on the list for an appointment. That is not transferable. I know that some of you are upset that you are selected ahead of a senior citizen. I understand that. But the county health department is only permitted, as I said, we have to focus a good number of our doses to those essential workers. So that is not transferable. If you're a school teacher and your school said it's your turn to get the dose, you can either say, yes, I'd like that, and you'll get scheduled through our system, or pass it to someone else. You cannot, the school will pass it to someone else. You cannot transfer that appointment to someone else. That happened today. We apologize for those people who were misled into thinking they could schedule an appointment. That is on the individual who shared that information, but we're not permitted to do that. So what we intend to do, again, starting next week with this data, essential workers will be randomly selected by your employer. How that gets selected is up to the employer. School districts can decide, law enforcement agencies can decide, that's up to them. The balance of our doses, what we're going to do is randomly select those candidates based on the criteria. Meet those criteria. You have a comorbidity or you fall within that classification. It's randomly selected. Each week we'll show you the percentage breakdown basically on what we know. So we know that if we had 1,000 doses, we'll tell you that about 200 went to this area of the county, or 200 went to this age group, or 200 went to that background. We'll provide you that as a form of transparency. That is the IT department has developed a randomizer. Simply select those names, and we will contact you. So you don't have to sit at your phone. You don't have to sit at the phone, sit at the computer, pressing the button. You're not competing. You're not racing, chasing a unicorn. We're just going to randomly provide you an appointment. It'll be we'll provide you the data to show you each week how that's been distributed, and you'll see that. So sit tight. Continue to obviously fill out that information, make sure you're registered, and that's how we'll be selecting those appointments. Now, if you can't get on the computer and you don't have internet access, you're not that savvy, we are launching on our COVID hotline a senior citizen assistance hotline. We are so through this hotline, 845-486-3555. If you or a loved one is a senior citizen and you don't have computer access and you want to make sure you're in the system, you will call that number. You push option 1. That is the vaccine update. When you hear that message, it'll give you an update on what we know this week on COVID vaccines. That'll also have been emailed out to folks, but it'll give you an update on vaccines. When you're done with that, if you need assistance, you'll push 2. So it's 1, then 2. On number 2, you'll get an Office for the Aging. You'll be connected with the Office for the Aging, and a volunteer or staff member will input your subscription information and get you on that wait list. So these 2 things we know will streamline the process. We also know will hopefully lower the degree of anxiety. Nothing we do is going to make everyone watching happy. This is likely the most reasonable way to confront the fact that we will have about 700 or 800 doses and 100,000 people that we need to get access to until the state broadens vaccinations. Now, we are getting questions about, we are getting questions about comorbidities. So, last week, the governor announced effective February 15th, if you have one of these underlying illnesses, comorbidity, that you will now be able to access, you'll be able to sign up to get an appointment at your local health department, with your local health department, to get vaccinated. Again, this is about 100,000 people. We have 700 doses, so it's not going to be that quick, but we are going to, through that randomized process, attempt to get to as many people as we can every week. Now, it is expected, we haven't finalized this as a region, but the 7 counties with our local healthcare providers are finalizing what we believe would be acceptable to confirm you have a comorbidity. We do not want to know which comorbidity you have. It is not our right to know it, and we don't want to ask you for that information. But we do expect there will be a form, basically a form letter that either Premier Medical, for instance, could simply hit send through its patient portal and provide to those patients that qualify with those comorbidities. It could be signed by a doctor. We also believe at the moment that a similar document signed by a pharmacist, if you don't have a physician but you're taking medication, whatever, confirming that it is for one of those comorbidities would be acceptable. So at the very least, if I'm preparing and I'm you, I would obviously give your medical provider, your doctor, the opportunity to prepare for that, but you'll want to reach out to your physician. And at the very least, an electronic letter or a signed letter by your physician would be sufficient to confirm your appointment in Dutchess County, when it becomes available. Dr. Karana, has Premier Medical Group decided yet, or I mean, I assume you're waiting like the rest of us, but do you have some idea as to how you will notify your patients that they qualify with under the state rule? And I'll just preface that question by also saying, preface your answer by also saying, we recognize it'd be a lot easier if you just got the doses and vaccinated your patient than have your patient call you, get a letter, so that they can wait to schedule an appointment with someone else. But have you confronted that question yet on how, for instance, Premier might address comorbidities and confirming that with your patients?
Yeah, we just discussed that. As you know, the governor just gave us the guidance recently that we can include those patients up there. So we had a conference call with our primary care physicians. So we know a majority of the patients who see us have some kind of a comorbidities. If you're looking at that, I would say 70% of our patients have some kind of a comorbidity, which is going to be diabetes, hypertension, heart disease, lung disease, or renal disease. So we are generating a letter. In fact, my management people are developing the letter today, and we're going to figure it out how will we inform the patients up there. It's going to be laborious work. I know patients will be calling all the doctor's offices, issue me a letter. So we are absolutely in the process of doing that today.
Okay, so you're confronting, and so if you're a patient not with Premier but some other physician, they're all sort of confronting the same basic challenge, but the county government's agreed that we want to keep it as simple as possible. We don't want to overburden the physicians. We don't want to make too many obstacles for patients. We just want to confirm one way or another officially so that we can get you through the process. And again, we all also agree that if there were more doses, those doses getting to physicians would be certainly more helpful with some of that population, and hopefully that happens soon. We are getting a lot of questions about schools reopening 5 days a week. There is no prohibition on schools being open. The county has no say in this. This is the state. But I will tell you that schools have to follow the basic safety protocols. And if they can meet those protocols and be open 2, 3, 4, or 5 days a week, they can do that. However, it has to be within the state established guidelines. These are not Dutchess County guidelines. This is not the county government directing. We've assisted schools. We also believe that and we've seen that the children being in school is certainly less likely to contract or transfer the virus, transmit the virus to others than not being in school. We know that an in-school setting is safer, but understand that in-school setting is safer because the schools are meeting certain guidelines and certain safety precautions, like fewer kids on a school bus and spacing in a school building. We support that. I have 4 kids. I'd like every one of them to be in school. In fact, if we're up to my wife and I, they would be in school every day for the next year. I say half kiddingly, but obviously there's backsliding. There's concern regarding socialization. We believe in getting our kids back to school. I support getting our kids back to school. I want my own kids and your kids back to school. The state establishes the guidelines. We advise the school districts what they are. And I know school superintendents would like to do more. I know that. I know that there are teachers and entire groups of teachers who want to be able to do more. They are following the state guidelines. And as those guidelines become a little less onerous, and they are, governor's making more announcements every day, I think that you'll see more activity. So we support that, but that is a determination that the state makes, and we'll support our school districts in trying to meet whatever those new obligations are. So, Dr. Karana, I know that a lot of residents both have generalized questions regarding the Moderna and Pfizer shots, but we are now getting much closer to what we think might be availability of the Johnson & Johnson shot. Could you explain to those listening the difference between the Pfizer Moderna, which is that messenger RNA, and again, I just pretend to be a doctor on television, and the Johnson & Johnson shot, which, as I understand it, mimics a little bit more of it looks a little bit more like the traditional kind of vaccine. Can you explain the difference between the two?
Yes. So vaccines are basically, if you go back to older vaccines also, they are basically a dead virus or inactivated virus. That's how all the vaccines are produced. So it's basically a virus which is injected, but it doesn't cause the disease. So based on that, the messenger RNA is the one which has the protein there, which gives the instructions to the cell. So it's not the virus which is injected through the mRNA, which are the Pfizer and Moderna vaccines. So basically, you get this messenger RNA, it goes into the cells, and it acts on the proteins up there, and then your body, your immune system is activated, which is the T cell system. Then it acts on the B cells, which produce the antibody. So there's no virus injected in your body. Johnson & Johnson and AstraZeneca, which may come out in a month or two, that's basically a vector-associated vaccine in which there is a virus, but it's a cold virus, which is called adenovirus, which has been inactivated. So the DNA of this coronavirus is introduced to that adenovirus, and that virus is injected to the vaccine up there. So the technology is completely different up there. But the way they will act, even the Johnson & Johnson vaccine, because it's based on DNA rather than RNA. The Moderna and Pfizer are based on RNA technology. The Johnson & Johnson, AstraZeneca are based on the DNA technology. But both will do the same thing in your body. So they act slightly differently, but the results are pretty much the same.
So now there are those who are watching are saying, well, wait a minute, the Pfizer and Moderna shot, we're told, have a 90 to 95% effectiveness rate, efficacy rate. And what they hear is that the Johnson & Johnson shot has maybe a 70% effective rate for most of the virus. And then they hear, but in severe cases, Johnson & Johnson seems to have about an 80 to 85% efficacy rate. What the heck is the difference, Dr. Karana?
Well, the difference is how many people will get infected, like 95% versus 85. But basically, I think we look for, even if you get a virus, if you don't get sick, if you're not hospitalized, and you don't die, I mean, that's what we're looking for. We don't want anybody to get a virus. But even if you get a virus, we get cold viruses all the time, in which we get sick for 3 or 4 days, need to recover from that. So Johnson & Johnson vaccine has enough data there which suggests even if you get the infection, maybe 70% effective, but nobody died during that study. Nobody got sick enough to be admitted to the hospital. The big advantage of Johnson & Johnson, obviously, is a single vaccine rather than 2 vaccines. Moderna and Pfizer, you have to give the second dose either 3 or 4 weeks later. But Johnson & Johnson, for the moment, it says only 1 vaccine. And the biggest advantage is Moderna and Pfizer need to be stored in a colder temperature. So it's difficult to store them. Johnson & Johnson is like any other vaccine. It can go to doctor offices. It can stay like any other vaccine for months and months. So for convenience sake, it's great. It's only 1 dose, which is great. And even if it's not as effective as the other vaccine, but if you look at people who get sick, it is as effective as other vaccines because people are not getting severely sick to be admitted to the hospital or dying. So and my suggestion will be whenever vaccines come out, whatever vaccine is available to you, take that vaccine.
Thank you for that. Although we do have a regular listener, Rita, who does not want the one that they're given. She wants the one that she wants, and I'll be sure to make. We should make sure, and I think it's a good point. You should check, right? If you know that you're scheduling an appointment with your physician, with the hospital, with your pharmacy or health department, you can always ask. What vaccine are they administering? And you certainly have the right to make that choice. But to Dr. Karana's point, as we understand it with the Johnson & Johnson shot, yes, it has a lower rate of sort of preventing you from catching COVID, but it is most effective from keeping that COVID, that virus from becoming severe and treating the severity of it. And again, the goal here obviously is to keep people from getting sick. First at all. Second, to keep that illness as keeping it as least severe as possible and saving lives. So you'll make those choices as the vaccine becomes available. You should check when you call, and you have the choice. You can decide. But as we tell folks, whether Dr. Karana is your physician or someone else, check with your doctor, talk it through with your medical professional. And make that decision with them, and I think you'll find that the science is sound, but then you make that choice, and so we'll continue to provide you opportunities, certainly those watching, to ask questions. If you have questions, please write them in the comment section below the live stream. We'll try to get to some more. Now, what I do want to do, Sean, is let's walk through the county's website as well. Yeah, so I'm going to address again. So there are residents saying other counties are going 5 days per week. The county is not allowing helping schools open. We are not prohibiting schools from opening. I just had a call with the school superintendents an hour ago. Every county is in the same situation. Some schools are making the choice, and they're taking the guidelines and sort of running with them. I don't know which school districts are open. Public school districts are open 5 days a week. A school district can assume certain risk. They're permitted to do that. But if there's an outbreak or if there's issues with staff, they can't function. So they make the choice to manage that. I don't know how to make that any clearer to you. Dutchess County government is not keeping school districts closed. We are all basically in the 7-county region functioning as a unit. There were some, I think, distancing, social and physical distancing differences in certain parts of the state. We've advised school districts that the state of New York is permitting that to occur. You assume the risk, but if you're following certain mitigation steps, as long as you meet those mitigation steps as outlined by the state, you're allowed to function. In fact, the county of Dutchess doesn't even keep those school plans. Those plans are between the school district, the teachers, and parents, and the state of New York. We just tell them what the recommendations are from the state. We provide them support, and if you're suggesting we're not helping schools, that just isn't true. We have an entire team dedicated to assisting school districts, and we assist. When school districts had concerns regarding staffing, we worked with them to come up with a new staffing protocol that not every circumstance requires every individual to quarantine. So we're evolving with the changing information, but we're not establishing and have not established any prohibition. So if you're being told that isn't true, and if you believe that it isn't true, we are providing the same direction that other counties are providing. I am aware, as I said, of certain districts that have altered the, as I said, the physical distancing limits. We not altered them. They've explained to the school district that they can do that. And we've done the same. We say this is the CDC expectation, this is the state of New York guidance, and as long as you can meet the basic safety mitigations like masks and those other things, you can function. And if you can make that work 5 days a week, God bless you. Make it work 5 days a week. I think there are a couple schools that are functioning at 5 days a week. That's up to the school district. We're not prohibiting it. And we continue to provide assistance. We provide assistance to access testing. We provide assistance to access vaccines. We provide assistance in giving our guidance. If you're looking for us to order them to do that, we have no right to do that. We have to tell them what the basic safety protocols are, and we support them in making those choices. But that's a decision, if you're a parent, that you can make with your school board with your school superintendents. We'll support them so long as they meet those basic safety protocols that have been established by the state of New York. And as I said, the state is saying that there's some variance from there, and we've told districts you can vary from there, but you have to obviously assume certain risk, and you need to achieve that with your parents and your faculty and staff. So other questions, happy to answer them. I do want to walk through a little bit of that website. So I want to mention one person, Rosemary Lloyd. Rosemary Lloyd watches us every week. And Sean, she can't get that subscription tool up and running. So I'm going to put on the phone number one more time. And Rosemary, I want you to call this number, 486-3555. When that phone rings, says 845-486-3555. You're going to hear a message. If you're a senior citizen and don't have internet access, or you're not easily able to get to that computer to sign up, call that number, press number 1. When you press number 1, you'll get a little bit of a message about vaccine distribution in the county. And if you still need assistance, press number 2. You'll either be asked to leave your information or you'll be rerouted to a volunteer or staff member who will input your information to that subscription tool. So the Rosemary Lloyds of the world and others, if you're having some difficulty getting online to make that adjustment, go to and call 845-486-3555. You can visit DutchessNY.gov. When you visit DutchessNY.gov, if you go directly to our website, you'll see right in front of you, I think it's 4 little boxes. One of them says COVID update. Or COVID information. Push that button. When you get to that button, you're going to scroll down the page a little bit further. If you're looking for vaccine information, you scroll down just a little bit further. Hold on, go back one, Sean. Scroll down a little bit further on the COVID update information. You'll see a syringe. It's a little graphic that looks like a needle. It is not the needle that we're going to use to give you the vaccine, but it is a needle. Push that button, and you'll get to the COVID vaccine update information, and here you are. If you're watching now, you'll see on our page there's the Sign Up Now button. You hit that Sign Up Now button, and you will be rerouted to fill in your subscription information. It'll be name, address, date of birth, contact information. Are you an essential worker? Do you have a comorbidity? We'll get that data in there, and that's our way of updating and ultimately getting you focused and toward an appointment. But if you scroll down this page, you'll see some other information. I'd like to think it's certainly as complete as anyone else. But if you scroll down, you'll see New York State sponsored sites. This is the area that you can review New York State regional vaccine distribution points. There's a link. Am I eligible? There's a phone number, 1-833. If you call or register with the state of New York, you are only going to be told when there's availability with the state regional vaccine sites. If you call that number and a nice gentleman is on the other end of the phone call, and you ask him, I want to get an appointment in Poughkeepsie, and he says, there is no Poughkeepsie on my map, that is true, because the state of New York is not going to give you any local appointment availability of any kind. You could live in Binghamton and want to go to the Binghamton Health Department, Broome County Health Department. They will not give you an appointment for the Broome County Health Department. They can perhaps give you an appointment to the Binghamton State Regional Site. Dutchess County, they're going to tell you first the closest is Westchester or Albany, and then from there they will tell you the location beyond that. It could be Potsdam, it could be Long Island. You will never hear on that phone number or at that website a local distribution point. But there is information there from time to time. The links pop up on our website, and you'll be able to check. So you should review that. A little further down the page, you'll get to the Dutchess County Department of Behavioral and Community Health points of distribution vaccine centers. Long story short, this is where the Dutchess County availability will be for the county health department only. You sign up, you get that notification, as I said, and then each week, randomly, you'll be on a wait list, and randomly we'll advise you of your scheduled appointment. So sit tight, fill in that form, you'll get that information. If there's availability, otherwise, it'll be here. It'll be in the middle of the page here. You'll see it, you can click on it, and you can be informed about it. Scroll down a little bit further on the page, you're going to see the pharmacies that currently in Dutchess County have access with their link. So if you want to find out that the Walgreens at 704 Freedom Plains Road in LaGrange has availability, you're going to click on that Walgreens, and you're going to be rerouted to their website to schedule if they're available. If you want to know if the Rite Aid at Vassar Road in Poughkeepsie has any availability, you're going to click on Rite Aid, and that is going to make clear to you whether or not those appointments are available. Now, a little bit further down the page, you're going to see hospitals and federally qualified healthcare centers, FQHCs. If there's a hospital or a federal clinic or some other healthcare provider that has availability, it'll be here. And you'll be able to click on those appointments and schedule through those websites. You'll see Sun River Health, Family Practice Center. Those are locations in Hyde Park, Amenia, Beacon, Dover, and Poughkeepsie. Those are also locations that have vaccines and may have certain availability. New York doesn't create a single location where you can schedule amongst them, so we're kind of giving you that one point. You go here, sign up for us. Once you're signed up for us, you don't have to. You can worry, but you don't have to worry. When we get to your name, we're going to notify you, and we're going to tell you. Again, randomized selection, going to let you know. But you can go back to this website and look at any one of these other locations, and if there's an available appointment, take it. A little bit further down the page are, again, the healthcare networks and the practices once they're available to you, like Dr. Karana. Once his offices have availability, you might find them in this link. And then Veterans Affairs. There are veterans. The VA at Castle Point has availability, and there's a link there. A little further, who can get a vaccine? This is the state's qualifications. You can review that a little bit further down. You'll see who falls in 1A, 1B, and what happens on February 15th with the change of allowing those with comorbidities to get registered, and then so on and so on and so on. Frequently asked questions at the bottom of the page. It is a comprehensive page that I encourage you to visit and share with others. It's not always going to be that there's an appointment available, but it does give you the basic information necessary to navigate all of that. Dr. Karana, what is today? Wednesday? Tomorrow, Dutchess County is, tomorrow, Dutchess County is administering some more vaccines. I think tomorrow we're focused. This week we're principally focused on essential workers, as I've said. We're also providing some appointments to phone-only seniors. These are some seniors who had no other access but to call in. So we're starting to route those through the system too randomly. But Dr. Karana, we're also in the process of administering the second dose of most of our shots. So, for instance, this week Dutchess County has 700 first doses and I think 400 second doses. So our health department's administering about 1,100 total doses. What's the difference between, from a medical perspective, what's the difference between the first shot and the second shot? Is there any difference?
Well, the first shot sort of primes you up for your immune system. It gets your immune system going. And the second shot, when you get it, your immune system is really working that level. So that's why what happens is if people, when you get the first shot of the vaccine, most people don't get any kind of reaction. And if any reaction you get is, most of the people get a second shot, which is minimal, which is you may have a little low-grade fever, a little chills. And most people, if you get the reaction, it's after second shot. The reason is the first one is like a primer. It gets you ready. For your immune system is already there when you get the second shot, and the immune system is right up there to take care of you.
Right, and we are seeing a little bit of that. The first shot, most people, maybe a little bit of immediate reaction, a soreness on their arm. We at our pods, we really haven't had any noticeable reaction of alarm, but we are seeing some individuals on the second dose. Maybe there's a larger rash, a little soreness. Some are getting a little bit of a chill, and then we do know. Certainly there are extremes, but we do know around the country folks might be getting a little bit of a fever. But that's the explanation, right? The first dose is it kind of warms up your body, and then that second one gives you that your body's ready, looking for it, and reacts to it.
Right, yeah. Right. Absolutely right.
I'm getting good at this. Do you know my mother named me Marcus after Marcus Welby, M.D. So I'm
really okay. I used to love that show.
I watched it in reruns because I didn't know it obviously as a kid. But I often joke I'm not a doctor, but I was named after a television doctor. That must mean something. I don't know what, but so a lot of folks are concerned about that reaction. We've been all encouraged not to necessarily call them side effects because, frankly, everybody reacts to a foreign body coming into their body. But there are some who don't understand the science so much and are concerned that there was some rush to get, in particular, the mRNA done. Can you talk a little bit to that? I mean, it does seem to some people that in just a few months they turn this medicine around. But messenger RNA has been around for a while, and can you talk a little bit about that?
Yeah, people are concerned. Obviously, the coronavirus came in last year, and in less than a year we have a vaccine, and you can understand people being skeptical of that. But this technology has been around for a long time. They've been working, especially with the DNA vaccine, since 1992, and when Ebola came in, that was the time they started developing the messenger RNA technology. So this technology has been around for a while, though we have never developed a vaccine with that. But we know what messenger RNA does, how it works. And the beauty of messenger RNA is, you hear about variants of this coronavirus. Maybe the vaccine may not be as effective, but you can change the messenger RNA very quickly, even from vaccine standpoint. If we feel the South African strain is coming here, which may be the vaccine may be less effective, but because it's a messenger RNA, it's not the whole virus you're trying to change. You can change it very, very quickly. But it's the safest technology which has been there for a long time, although we never had a vaccine on that. So I can assure you this is nothing which has been done in haste. And,
there's always the chance that someone can have a severe reaction to a vaccine. That is truly always a possibility. I mean, quite frankly, you put anything that isn't supposed to be in your body, you can react poorly to it. From your, and again, I don't want to put you on the spot in this case, but you can tell me you just haven't followed it. But what we've seen as a reaction to these vaccines, are we seeing an unusually large number of negative effects, or is this within the realm of sort of expectation when it comes to vaccines?
I think it's like most of the vaccines, like a flu vaccine, maybe a little bit more than the flu vaccine. I personally know of literally hundreds of people, lots of people in our practice, all the doctors and the nurses who've gotten it. I have not heard about even one person who had a terrible reaction. The most I hear is, like you mentioned, the soreness there, maybe a little low-grade fever, maybe a little chills for 4 hours or so. But I have not heard anything from anybody who had a bad reaction. Even in the literature, we could see how many people have been vaccinated in this country and around the world. Severe reaction is maybe 1 in 2 million people, if any. But there has been no deaths or anything like reported ever since we started the vaccination program across the world.
So,
which is related to the vaccine.
Right. So we're all hearing about these variants to COVID-19, and of course, I think we recognize that viruses mutate. And I've hesitated to call them, to nationalize them, because I don't know that there's really a reason to do that. But we're told that the vaccines to date seem to be very effective in dealing with what's being referred to as the UK variant, but maybe less so with what's being referred to as the South African variant. Again, I don't like those nationalizing things. It seems to me that it's a variant. Right. I'm sure there's a technical name. What's your understanding of that, and why might that be? Why would the vaccine be more effective with one variation of one mutation of the virus versus another?
I think the variant depends on how many mutations you have on that virus, because viruses keep mutating all the time. If there's one mutation, it probably won't affect the efficacy of the vaccine. If there are 2 or 3 or 4 or 5 or 6, if there are too many mutations, it changes. Then we call it a variant, because there are too many mutations in that virus. So that's why the vaccine is not effective. But at the same time, even in South Africa, where you heard the news about AstraZeneca, it was not effective. But this was only in transmission of disease. But nobody got sick even in those cases. Even if it is not as effective, but you still are not getting people to be sick, to be hospitalized. And that study was only a few thousand patients. So I think we need a lot more data before we can say that these vaccines are not going to be effective in those variants.
And so we've had some physicians on before, and of course Dr. Anil Waidyan, the county's commissioner of health, is an infectious disease doctor. There's been some questions about, so if it keeps mutating, right? If it keeps altering, why would we continue down the road with the vaccine, or would we continue down the road? Do we have to change the vaccine, or should? And I think, it's sort of the way I've described it to people is even though the virus mutates to some degree, and that's to stay alive, right? The virus wants to be alive. And it wants to get, it needs a host. So it mutates a bit to stay alive. Is that? I mean, I'm using a generalized analogy. But as it does, as we vaccinate, we're kind of cornering it. And the more we vaccinate, the more we're cornering it. And yes, it's likely to mutate to kind of navigate through and around the vaccine. But the more people have either contracted it or have gotten the vaccine, ends up slowing and ultimately, using my term, cornering putting the vaccine in a corner. Is that's sort of like the concept behind herd immunity, right? We more people get sick.
You're absolutely right.
Okay.
If there are lots of people who get infected with the virus, virus is gonna do what it does. It just keeps infecting and keeps changing. It wants to stay ahead of you. Basically, that's what virus is doing. By vaccinating more people, we want to be staying ahead of the virus. So we don't want virus to lead. We want us to lead the virus. So if we have more people vaccinated, there are going to be less pool of people who will be infected. So the virus is not going to have a chance to mutate. But like you mentioned, like a flu virus keep on mutating. That's why we keep on changing the vaccine every year. It's a new vaccine for the flu. I think same thing will happen with this virus. It's going to keep changing. So every year there will be slightly different vaccine will come out, which will be effective against the new variants or new mutations.
Great, thank you. Thank you for that. We have a couple more questions before we close up related to vaccinations. And so first, the questions regarding restaurant workers getting vaccinated. So New York State has permitted those individuals who work at restaurants or those, I think, taxi drivers as well, to be qualified for vaccines. What we're telling you to do in Dutchess County is to sign up, but I will tell you that we are giving priority to that vulnerable population first. And so I'm going to say this out loud. It's not you can't get the vaccine. It's just our focus at the moment is to get to those with the underlying vulnerabilities, those comorbidities, and senior citizens. So I would say to you, please do register. And as appointments become available, you'll be advised of that. But understand that that is not likely to occur until we make decent progress through the more vulnerable populations, those with comorbidities, and the assigned essential workers that we started with. This 1A, 1B category that included law enforcement, which we're very close to reaching the goal of vaccinating everyone in law enforcement who wanted to be vaccinated. Fire, we're making good progress, and then school teachers, etc. They're making decent progress. But I would tell you to register, get on the list, be in the system, and when appointments become available, just know that currently we're giving priority to those with those comorbidities, those vulnerabilities, and those who might not weather. I shouldn't say that. Those who fall within those categories. So just be aware of that. What we will do, we had a few questions on nursing homes. Currently, I mean, they can meet some visitation standards, but I don't remember what they are. So what I'm going to suggest to you is, number one, we'll provide an update this week somehow. We'll at least remind people what the nursing home guidance is, and then next week when we meet, I'll have a detailed answer for you. Sadly, though, it is clearly again. The virus has found its way, and it has back into nursing home facilities. This has been over the last 2 months. We see a lot of obviously individuals contracting and then finding their way to the hospital, and many succumbing to the virus. This is heartbreaking and certainly just maddening in scope. So I'd like to. I don't have that information at the top of my head, and I don't think we were prepared for that question. So what I would ask, what I'll ask your communications folks to do is just update on Facebook as to what we know regarding the nursing home visitation and the guidance that the state has, and then next week I'll be prepared to give you some updates. So let's do this very rapidly. I know the sign language interpreters love when I speak rapidly. So I'll be as quick as we can. First, hearty thank you to Dr. Sunil Karana from Premier Medical Group. Dr. Karana, you've been a great guest with us today. I'm thankful that you participated. We're going to let you get back to work. Are you still taking patients, or are you full at Premier?
No, we're still taking patients. Our primary care, we have a great primary care physician up here. We welcome new patients, and we provide a great service.
Well, I would say this is me releasing some of my medical data. I will say selfishly, although we've had all of our groups who are being represented, but you are my Dr. Buffa in your practice is my GI doctor, and after these last 12 months, I can tell you, stomach problems are the least of my worries.
We can understand that.
But you've all been terrific, wonderful. Can I put you on the spot? Have you received the vaccine, or are you planning to be vaccinated?
Yes, I had vaccine. So I tell you about I myself had a coronavirus in June, but I was a fortunate one who didn't really get sick or so. But I did quarantine myself. But the recommendation was, even if you have the coronavirus in the past, you should have vaccine. So I have both the dosage. And after the first dose, I had mild reaction because I had a coronavirus. So my first dose was like my second dose. In fact, there's some preliminary data now, very preliminary, that people who had coronavirus in the past maybe they need one vaccine. But I'm not saying that. I'm not recommending it. It's just something we will know more about it. But yes, I had the vaccine, and I had no problem taking it.
Well, I thank you for sharing that. And I think it gives some degree of confidence when your physician is taken the vaccine and can kind of talk a little bit about it. So we do appreciate the partnership. We appreciate the work that you do. Please send our very best to the staff and the physicians at Premier. We're very, very grateful, not only for these last 12 months, but for all the years we've worked together. We're going to let you get back to work, Dr. Karana. Thank you very much.
Thank you, Mark. Appreciate it.
You're very welcome.
Bye.
So as we close up, I just want to remind you just two things. So the county is updating its appointment system. We're trying to make it easier for you, less stressful, and more streamlined. Sign up for our wait list notification. So the vaccine information form has been updated. We're asking for a lot of detail. You must sign up. The information that you include must be the information of the individual seeking the vaccine. So you're welcome to sign up a loved one. You're welcome to sign up a neighbor. You're welcome to sign up a stranger. But it has to be that individual with their information. It can be your contact phone number if you'd like to be the point of contact for your mom or dad or grandparent. But it must be their information because we have to evaluate that based on the criteria the state sets. Fill that out. You will not only receive a regular update, which might be once or twice a week, depending on the information we have available to you, but it also will put you into the pool that that we will use to schedule appointments. When there's an appointment available, we will contact you. We will send you an email or a text message to get you scheduled for your appointment. The county currently has, the local health department currently has 700 doses. There are approximately 100,000 people who qualify in these categories to receive a vaccine by the county health department. So if you're expecting that to happen overnight, the odds are it's going to take a little bit of time. But there are also odds that will, based on randomizing the selection, that might have you get your appointment very, very quickly. So please understand that that's the system we're going to use. You sign up. It doesn't pre-register for an appointment, but it gets you on a wait list, and when the appointment's available, we're going to tell you that. And we think that is a safer and more reasonable way to do that. If there's not going to be a link on the website, you're not going to jump to it tomorrow. From time to time, there may be on the website other links to schedule appointments. You don't have to sit by the computer at 12:10 p.m. and get every family member to click on it. We've told the state this is the way we're going to do it. If you are at home and you don't have, although if you're watching, you have some internet access, but if you don't have internet access, you know someone who doesn't have internet access, you're a senior citizen who might not necessarily get through all of those forms, we are launching our senior assistance number through the county's coronavirus hotline, 845-486-3555. Dial that number. Push option 1. You're going to get the weekly vaccine update. If you need us to help you input your information into that database, that information system and that wait list, you'll then push number 2. Push 2, you'll either be asked to leave your information on voicemail and or you'll be rerouted to a volunteer or staff person who will help get that information inputted and will get you into the system so that you can qualify for an appointment. We hope that this is a easier and certainly it's more reasonable way of trying to get people scheduled. We hope you find it useful. If you have additional questions, please feel free to reach out to us throughout the week. We'll try to get you many answers. Please understand, again, that county governments are not in control of vaccine distribution. There are approximately 3,000 doses being administered in Dutchess County this week. That is determined by the state of New York, and that is not determined by the county of Dutchess. We have, as I said, we have about 700 new doses we're administering this week. We're focused on that essential worker class that we've talked about in the past. We have enabled some seniors who have been calling and don't have internet access to get into an appointment. We wanted to try to be equitable in that regard. And then the new system will roll out for appointments beginning next week. There are about 400 second doses that the health department's administering. You're going to see on our website some updated information. And we'll provide that regularly. As I said, we'll try to provide you a demographic breakdown or some basic information regarding who's on the list and basically who we've gotten scheduled. We'll tell you each week what we believe to be the number of doses coming to Dutchess County and the number of doses Dutchess County government will have access to. We'll also provide you the number of doses we expect to administer and the total numbers we've administered. We're going to try to do that weekly. That hopefully will appear in some way associated with the county's dashboard and on our social media. Look for that as we roll out the new program. In the meantime, we've run a little bit late, but I do want to thank our sign language interpreters. If any of you, like me, watched the Super Bowl on Sunday, you saw a really boring game. I mean, nobody can call that an exciting game. It wasn't an exciting game. It was lopsided. Tom Brady is. I wasn't a Patriots fan, and I can't say that I'm a particular Tom Brady fan, but he is the greatest quarterback of all time. There is little question that man may single-handedly be able to bring a team to the Super Bowl. And Rob Gronkowski, my gosh, the two of them need a comedy show. But that said, if you watch the Super Bowl, you may have enjoyed listening to the music. I'm still lost in a labyrinth with The Weeknd. But nevertheless, if you watched the Super Bowl and you saw the national anthem, you saw another display of what it means to think differently. An American Sign Language interpreter, nicknamed Wawa, put on a performance that, quite frankly, if you didn't understand sign language, you understood it anyway. And so these men and women have certainly been with us for 12 months from the day we started these town hall meetings, and we've, of course, used them for years, which is probably why their arms keep pace with my talking. But they have done... What is that? Is that...
That's you talking. Fast signing, you talking.
That's so Mark Molinaro. Fast talking, fast signing. I learned one today. Thank you. But they've done wonderful work, and I wanted to say thank you. I do to them. We've seen a number of faces come and go throughout these months. But if you saw that performance on Sunday, we didn't need any music and we didn't need anything else. We all felt as one watching Wawa sign the national anthem, and there's something very, very special about that. So thankful to them. The other I want to mention is the county's communications team. I don't think I've done this in 12 months. We have evolved these town halls to be as effective as we can. We try to make them as convenient for you as possible. You probably have noticed the technology change, but never really paid much attention to it. When we started, it was just me looking at a camera. And we expanded to include, slides that I could show you and so on. And then we digitized a lot of it, and we have this computer-generated stuff that, if you can see is on the screen. This takes a lot of time. There's also in the room with me 2 masked individuals who make sure they keep up with the slides coming up, switch between Dr. Karana and us, live feed right here. We're running a little broadcast studio from my office. And then we also watch the questions that come in. And a lot of times, and I saw this, and I apologize, I forget, I think actually the woman's name was Rita, was upset we didn't get to her question one time. We try to get to as many as we can, but when you put them in that feed, sometimes your question just disappears. It's in the midst of 20 others. Sometimes we're doing direct question and answer. Sometimes we're trying to sort of coalesce a few questions and get the sense of the question to give you an answer. I'm rambling on because it takes a lot of time and talent to kind of do that. These are the same people who in the county executive's office, at the hotline, at the Department of Behavioral Health, are taking thousands of phone calls a week. Some governments don't respond at all. We can't get to all of them. We try to. In fact, I think we probably beat ourselves up more for not getting to the calls than the ones we do. But you're talking thousands of calls and human beings who have been working 12 months straight trying to give you information. Most of the time, those calls end better than they begin, but many times they don't begin very well. I know you're frustrated and angry. All I can tell you is the people on the other end of the phone, at least in my office and in this county government, they really want to help. So when you're calling in, I'm not asking you to not be passionate or not to be full of energy, but do understand there is no one here who wants you not to get the information you need. There's no one here who doesn't want to help you, and there's no one here who doesn't want to get you to the goal of what you're looking for. So it's a vaccine or a test. They want that to happen. But a lot of times our hands are tied and we're trying to give you that information. So they're receiving the calls. I just tell you, if you get a chance, you might say thank you to them. Don't feel you have to, but I do. They've done a wonderful job these 12 months. We're going to keep at it. We're nearly exactly 12 months from the day of our very first positive case of COVID-19 here in Dutchess County. We've learned a lot together. We've made our fair share of missteps, certainly, but we've tried our very best to give you the very best, and we're going to keep at it. So in the meantime, if you have questions, bring them our way. We'll try to get you answers. Please stay healthy, keep strong, and be kind to each other.